Hi, welcome to Babinda Multi-Purpose Health Service. We're a general practice, emergency department, hospital and residential aged care facility all under the one roof. Here at Babinda Multi-Purpose Health Service, we can meet your rural generalist training requirements, and we're the only general practice training facility accredited within the Cairns and Hinterland district. We are excited to welcome you to come and see what Babinda could offer you for your training requirements, whether it's medical, nursing or allied health.
There's so many great parts about working in Babinda. I like the variety, obviously, that's a really diverse setting. You get exposed to lots of rural generalist skills.
I like the diversity of the work that I get to do. I have patients who I see in the clinic, and then if they show up on the other end at ED, I know their background and history, so it's very convenient having the flexibility of managing a patient that you know well because you manage them from the primary care aspect.
I've come down to Babinda because it's a training facility for ACRM, and it gives me an opportunity to do some rural and remote medicine in a place that is a small community. I get GP exposure and I get emergency department exposure and hospital exposure all in one place.
I found Babinda an amazing place to start my internship. The doctors, the nurses, the allied health staff, all of the admin staff have been really welcoming and keen to teach. I love that there's a variety of presentations, that I can get to work in the ward, go to the ED and then do clinic all in the same day.
I enjoy working across a multidisciplinary team at Babinda Hospital. I get to work with doctors, nurses, allied health.
We've got residential aged care, the clinic, ED and of course the acute ward is fantastic. You get to experience all those different people, all the different cases, medically and socially, of course. Babinda is a very social community and a lot of our patients and residents are locals.
I guess a typical week at Babinda would, I might work Monday and Tuesday in the clinic, and then I might get a handover from the other SMO on the ward and do the on-call that evening. And then Tuesday night on-call, I'd then do Wednesday through the day in the hospital, maybe another on-call, and then Friday might be a final day in the hospital, or I might be back in the clinic. So I think that roster works really well and it's really flexible. We've got a small team but a dynamic team, and we're really supportive of each other.
Babinda Hospital support you in trying to further your career, so we have regular intervention with our management about our career goals and plans, and they're very supportive in trying to help you achieve those goals.
I've had lots of continuing education here at Babinda. I've continued to work as a registrar through my ACRM training. I've done my GP MCQ and my Viva exams, my stamps, which have been really well supported by Babinda. I've had been able to get leave when I needed to for my exams and for study.
Working in Babinda is like working with family.
The friendliness of the staff across the board, operational, nursing, medical, everybody's very welcoming.
Relationships that you build with both the community, the medical team, the nursing team, the allied health team is just such a wonderful experience, and everyone's been really supportive of me during my time here.
I also enjoy how flexible it is having a young family, so I've got really supportive management who are happy to accommodate, and a really supportive team who support me with that as well.
This area is so nice. There's lots of things to do on the weekend. If you don't mind a bit of rain and getting a bit wet, there's some really great walks around.
There's definitely some beautiful walks and hikes around the area. There's the Pyramid, Bahana Gorge, Nandroya Falls.
I bushwalk, I do a bit of running, I do a bit of cycling, and I spend time with the family.
Oh, it's beautiful up here. I can't imagine you'd want to live anywhere else really. Like, you get all the great parts about the tropics, you're close to the coast, you're near to the Barrier Reef. There's thousands of things to do on the weekend walks, so the Babinda boulders are just down the road. I mean, the other things are the community stuff, like the local restaurants are all owned by people who you see in clinic. It's really easy to integrate into a place that's that small and that close.
Now that you've heard from our team, if you're interested in pursuing your career here with us at Babinda, we look forward to you reaching out by phone or arranging to come and have a visit and see our facility in person.